Okay, this video is from the book Dr Mcdougall, The Doctor Who Fought for You, the chapter on dementia, part 2. The book's by me, Pete Rogers. Okay, so Dr. Mcdougall wrote about Alzheimer's disease. And by the way, just so you know, Alzheimer's disease is a bit of a joke. I would just call it dementia. There's a tendency to default everything to the word Alzheimer's disease. And that came out of games being played by these foundation industries that wanted more grant money. So they tried to say almost all dementia is due to Alzheimer's. And if you ask the average doctor, including neurologists, they'll tell you, Alzheimer's is the most common cause of dementia. But as I've said before, I think it's a BS. I don't even think it exists. And I say that because there is no clinical historical finding to diagnose Alzheimer's. There is no physical exam finding. There's no reliable blood test. The imaging tests are not that reliable. I'm a neuroradiologist. I look at brains all the time. And even at autopsy, they have a hard time diagnosing Alzheimer's. And they have no treatment for it. So something you can't diagnose, and even at autopsy, and you have no treatment for, what kind of a disease is that? It's a BS disease, okay? So anyways, we'll talk a little bit more about, so let's just say dementia, all right? Alzheimer's dementia is theoretically characterized by extracellular deposits of amyloid. These are your so-called senile plaques, and intracellular neurofibrillary tangles. Okay, worldwide, the incidence of Alzheimer's is more common in people who eat, let's just say dementia is much more common in people who eat meat and dairy, who eat animal foods. Okay, diets high in fat, saturated fat, have a lot more dementia. Aluminum is a major neurotoxin. People who eat more aluminum, people who got more aluminum in their drinking water, they get more dementia. And it can even happen suddenly, like when they accidentally put aluminum in the water for dialysis patients, they get aluminum encephalopathy pretty rapidly. Okay, let me get the picture here. Aluminum is absorbed through the gut wall, and that's the other thing too. You probably all heard of aluminum is now used in tap water in most cities as a clarifier because it binds other particles to it to make the water look more clear. But the reason that's completely stupid and ridiculous is because aluminum is absorbed through your gut, and it then is a brain neurotoxin. And typically these municipal waters also have F- in there, fluor-ide. And guess what? Aluminum forms a complex with fluoride, and fluor-ide increases traversal of the blood-brain barrier. So the two of them together make it more neurotoxic. And guess what? They're both also toxic to sperm production. So I'm 100% certain it has to be a coincidence that the stuff in your drinking water sterilizes you and makes you stupid. Okay, I'm sure it's just a coincidence, just like it's just a coincidence that, soy is sprayed with GP, that's a neurotoxin and endocrine toxin, and just like corn for high fructose corn syrup and cornbread and all those other products is also a neurotoxin and it lowers fertility. I'm sure all of these things having a synergistic effect to lower your fertility and to lower your IQ is just a coincidence, but being aware of them, you can better avoid them, okay? Desferoxamine is a chelator that can be used to remove aluminum from your body, and Dr. Mcdougall even says he would recommend treating Alzheimer's patients with that aluminum chelator. Another thing that I thought was kind of funny, the big world researcher, the big expert of the world for aluminum, his name is Christopher Exley, PhD. He's so famous in aluminum research that his nickname is aluminum, okay? So this guy recommends you drink water, bottled water that has silica in it, because silica is an aluminum chelator. And that sounds like a great idea. All I got to do is drink bottled water with silica and I can get this aluminum out of my body. But there's one little catch. Here's the catch, like a typical bottled water with silica in it is Fiji. Well, where does Fiji come from? Fiji Islands, but it comes from volcanic rock. Why is that funny? Because the volcanic rock tends to have a lot of F- in it, a lot of fluor-ide. Okay, so you're robbing Peter to pay Paul, okay? It's stupid. You're loading up on fluoride. It's got one of the highest levels of fluoride in the bottled water, so I thought that was funny, because that's a major neurotoxin, okay? It's proven, well known to lower IQ. And it's bad for your reproductive system, okay? Other things you want to avoid doing. Tea is really high in aluminum. Now, some people will tell you, well, in tea, most of it is bound, so you don't absorb that much. You know what? I would not take my chances with that. My advice is don't drink any tea, okay? That's what I do. Don't want to cook on aluminum. Some of my Puerto Rican cousins used to cook on aluminum. I told them they're stupid. They told me to piss off, okay? Don't cook on aluminum. That's a stupid thing to do. Don't take antacids with aluminum in them. Stupid thing to do. don't use deodorants with aluminum in it. I don't think you need deodorant at all. I think deodorants are for low IQ conformist chumps. When you walk in a room, somebody says, "Hi, how you doing?" Okay, you don't sniff each other's armpits, all right? And by the time a man is sniffing your armpits, he likes you, okay? You don't need to worry about your deodorant. And the reason is when you put deodorant with aluminum in it in your armpit, you have shared lymphatics between your upper outer quadrant of the breast and the armpit. And basically, upper outer quadrant breast cancer used to be 30% of breast cancer. Now it's 60% of breast cancer. And the big difference is people putting aluminum in their armpit where there's shared lymphatics. And a lot of women, too, they shave their armpit before they put the aluminum deodorant on there, which increases transdermal absorption, meaning aluminum is a metalloestrogen. It stimulates proliferation of breast ductal cells, like breast ductal carcinoma. So it's a very stupid thing to put in your armpit. And it's also stupid to spray it on yourself, because you spray it on yourself, you inhale some of it. And the inhaled component goes right through the olfactory nerve, right back to your brain. And the olfactory part of the cortex, primary olfactory cortex, is right next to the hippocampus, your memory center. So you don't want to do that. Totally stupid. Okay, anything sprayed can get access to your nose. And now they even have aluminum in the trails. Great, so you're inhaling it, literally, okay? And you don't want to live near a factory that works with that stuff. You don't want to be one of those metal sheet workers putting that on houses or something. Not a good idea to be doing that. You can get a little bit of it out of your body by sweating. So it's another good thing about exercise. Okay, McDougall says the dose he would use of desferoxamine aluminum chelator would be 125 milligrams intramuscular twice a day for 5 days per week for months, maybe years on end, to keep removing aluminum from the body. It also removes iron. A lot of people are iron overloaded, and when you're iron overloaded, it starts becoming neurotoxic as well as being toxic to your blood. It's prothrombotic because it redox cycles in your blood. I gave entirely separate lectures on the subject under my Douglas Caleththeresia Praetoris lectures about postprandial endotoxemia. Okay, so if you want to look that up, you can. Dr. Mcdougall's newsletter, December 2008, the Atkins diet is associated with brain impairment. And he talks about how low carbohydrate diets are associated with worse cognitive function. Memory impairments during low carb diets. You see it in animal studies. As soon as they start feeding them high fat diets, all the mice get cognitive impairment, which I find funny. They have decreased memory function, decreased ability to find themselves way back to a safe spot in the water maze type of things. Okay, Dr. Mcdougall writes about headache. Here he says, foods are the most common cause of headache, especially foods like milk, other dairy, eggs, chocolate, corn, wheat, alcohol, tomato, and strawberry. He doesn't mention MSG. MSG and caffeine are also major causes of headache. MSG as well as excess MFG, manufactured free glutamate. In his newsletter, September 2010, he talks about better moods from a vegetarian diet. That's a well-known thing, and I have a whole entire lecture, I have a whole entire book. You guys saw my book that I wrote about food and mood. I wrote this entire book called Food, Mood, and IQ. There's a giant association between food and mood. I know from my own personal experience that I did eat animal foods years ago. Up until about 25 years ago, I used to eat animal foods. I actually only ate skim milk, but before that I would eat beef, and that beef and chicken would be the only types of meat I would eat. But I know my personality, I mellowed out after I became 100%, after I became vegetarian, and then when I became 100% vegan, I mellowed out even more. So some of that might be getting older, more mature, wiser, but some of it I think also is from the diet. Let's see, lecture on antacids. They're associated with increased risk of dementia, hip fractures, and pneumonia. There's also one lecture on periodontal disease and diet. So anyways, yeah, that book, Food, Mood, and IQ, I go through all of the dementia prevention stuff. So if you want a book on preventing dementia, this goes in tremendous detail. And McDougall is the greatest doctor in the world, but I can also tell you, though, when it comes to the brain, I know a lot more about the brain than he does. I'm a brain doctor. That's what I do for a living, and I've studied it in great detail. I've written a couple books about cognitive function, preventing dementia. You've seen that, The Poor Man's Guide to Prevention of Dementia, as well as this book, Food, Mood, and IQ. I can only put so much words into the title, but it's also about how to prevent dementia. And I go through all the newer mechanisms of dementia, the dilatory theory, the mouse equivalent theory of hypotension and vascular hypoperfusion. I go through the Kellen-Pretorius theories of postprandial endotoxemia, Ferris redox cycling, I go through the whole, then I go through the Jared Younger stuff on LPS and LTA and how they activate microglia and cause collateral damage to brain cells. My own theory, the supply and demand theory of dementia. I go through all of that stuff. I go through the Yamashima theory of lipid peroxidation, toxic aldehydes, hydroxynonenal, as well as the calpain-cathepsin component of that theory. So I realize that's a whole bunch of stuff to throw at you, but what I'm letting you know, the good news is all of these things you avoid by eating low-fat, low-sodium, 100% vegan diet, 100% organic, with no oils, okay, no caffeine, all right. That's how you keep your arteries open and you avoid all these unnecessary stimulants. There's lots of stimulants in processed food, from the manufacturer's free glutamate, and then there's mitochondrial inhibitors in it, so you're screwed in both directions. You're ramping up the neuron metabolic rate while you're simultaneously dropping the ability of the neuron to produce ATP, which it needs to do to pump calcium out of the cytoplasm to quell the excitotoxic effect. So anyways, I talk about all that in much more detail in other lectures. If you're interested, just search any of my lectures on dementia prevention. So that's it for the dementia chapter in the McDougall book. I hope that was helpful.